Hello, I'm Dwight Eubanks, and I'm here with America Top Salon. I'm here with the CEO and president of stopCAID Now. Lisa, tell me about CAID, and to just look at you, you're all so fashionable and always so beautiful. Love the toenail polish, the white nail polish on your nails, and this fabulous skirt. And it's all connected to fashion and beauty, and that's what this whole episode, this whole series is about, and the connection and the marriage between your life and just the amazing things that you're doing with your foundation. Tell us about that.
Thank you. Well, stopCAID Now, I coined CAID, which stands for Childhood Autoinflammatory Diseases. And I coined it out of desperation because my son Brody has no prognosis and has a very rare and genetic disease that falls under an autoinflammatory category.
Now, he was born.
He was born with it, but I didn't really recognize his symptoms because, you know, as an infant, you're crying and you have some of the more normal symptoms that you can have. And but it wasn't until his 6th month that I really started noticing his fevers were continuous, and they would go up to like 105, and they would be repetitive. And then he would have these rashes on his body, and now I know that the rashes were actually the inflammation in his body that were so severe that you could see on the outside. You couldn't touch him. I mean, he was always in a diaper. As a matter of fact, Brody's first words were boo-boo, and he would take Band-Aids and try to cover up the rashes because he thought that the Band-Aids would take them away. But the most, I think, significant thing that brought me to the hospitals more so was that he was in such excruciating pain. And the pain is caused by this inflammation.
And there's nothing that you can give him or the doctors can give him?
Well, for the 18.5 months, I pretty much just would bounce him. And everybody who follows me knows that I'd be on an exercise ball and literally just bounce him and try to soothe him until there was a diagnosis. And then the diagnoses of atypical Blau's syndrome and now vasculitis and possible mitochondrial, he was given over an adult dose of injections daily. So when we got that diagnosis, I'd literally have to sit on Brody and give him 2 injections a day. And he was always so strong, even as a child, like just strong-willed, that he would take his leg and do this. And so the injection would come in and out. And then he got very comfortable. He hit a plateau with these treatments. And then I had to keep going to another treatment, and then right now there's other options, but I'm pretty much at my last option for him, which he's the only child at CHOP who gets infusions twice a month of Remicade, which helps with his infusions. He is so used to pain that it's become his norm. So his 10 is normal. It's when he's above 10 that he gets really where if you walk by him, you'd be like, this is a child with a meltdown, where you can't, he's in so much pain you can't even communicate with him. He's erratic and just screaming, and normally that would be how my nights were. I'd be up all during the night, maybe an hour a night of sleep. And
so you mean to tell me that this is ongoing? It's
ongoing. It's ongoing. I mean, he definitely has more relief with the diagnoses and treatments. I mean, but it takes the edge off. It doesn't take the pain away. He's just so used to it. Like, we were he got an infection of the cartilage in his ear, and we were at the hospital, and the doctor said, well, what's your level? And he said, red. My head's always red. And that goes to, I developed a pain buddy. And it's kind of like the smile, you know, the scale of the smiley faces, and this pain buddy is plastic, and it looks like a little boy, and it's cut out, and it has Velcro on different areas of the body. And there's red for very painful, orange for medium, and then yellow for it hurts but not so bad. And so he can take the arrows in the morning or the day and place them on the body. So he was telling the nurse, and they were like, well, you're not screaming, crying. And he goes, but I'm always in pain. And it's just telling. I mean, here's a 5-year-old who flushes his own IV, puts himself to sleep, so he's gone through the ringer. It's never easy as a mom to see your child in pain. I think as most who have followed me and as I had shared with you, is that when he was a baby and he'd be screaming in pain, I would look under his clothes and be like, what's prickling him, or what's on him, or what can I do and stop it?